Hi, I'll just remove my mask because I know there is nobody 6 feet around me. Namaste. My name is Dr. Shalini Joshi. I'm an internal medicine consultant at Fortis Hospital, Bangalore. Welcome all. And I know we are living in a very difficult times. And we have been living like this for last 1 year. And it is unprecedented times. Nowhere in the world there has been such a tsunami of COVID cases as we are seeing in India right now. Healthcare structure is stretched to its limit, but still, doctors, nurses, all the ward boys, staff, frontline workers are all working round the clock to keep you safe. And not even a single doctor has quit, not even a single hospital has shut down. So we are going to win it, but in this time we have to support each other thoroughly. Now, about the second corona wave, COVID-19, there are three important points I would like to make. First of all, it is affecting our younger generation, 20s, 30s, 40s. Earlier, it was the elderly people. Maybe it is hitting the younger generation because, first of all, they are not vaccinated. Second, those are the people who go out to do groceries, to do are traveling in the public transport, and they are also sometimes not doing the COVID appropriate behavior, like putting on the mask, or when they are talking, they put down the mask with their friends, or they go to meet their friends, or they are going to the restaurants more. But there is a peculiar trend which is affecting our younger population this time. And also, our latest data is showing that it is airborne, and that's why more infective. It's very infectious. The whole family gets infected with a very short span of time. But I would still say that 80 to 85% will be asymptomatic or mild disease, which can be easily managed at home. So there is nothing to panic, but there definitely we should be alert and on top of it. And 10 to 15% sometimes will need hospitalization, out of which a very small percentage, 2 to 3, will get admitted to the intensive care units, which need more oxygen support and need more care, more intense monitoring. So I am going to be talking today for 5 minutes, and after that, we will be taking question answers about those 80 to 85% who are sitting at home and listening to this session from Fortis Hospital Facebook Live. That what can you do when you are at home, and so what exactly happens? See, we have been all listening to we know all the symptoms, we know what to do, but sometimes when it comes to your own self, you have some cough cold, sometimes we tend to ignore it or rationalize it. Or maybe I ate, मैंने तो आज कुछ लस्सी पिया था इसलिए गला खराब हो गया, या मैंने तो ठंडा पानी पी लिया, या बारिश आई थी. We try to generalize, we try to rationalize that maybe it is because of that. So now is not the time to do that. अगर आपको लगता है कि आपके कोई भी फैमिली मेंबर में they are getting any cough cold, even the kid gets little sneezing, stuffy nose, little headache, or the elderly parents are saying, I don't feel like eating, bhook nahi lag rahi hai, I'm feeling weak, tired, no fever is there, khana acha nahi lag raha hai, extreme tiredness, you have to suspect. So first thing, I'm going to point out 5 points in my talk today. First point is when to suspect. So these are all the things when you suspect corona, which could be, I'll reiterate again because this is very important. You can prevent a full blown infection to the whole family. You can save so many people if you want to, if you can identify it early on. Then what you have to do, you have to isolate that person. That's all you have to do. So if there's any cough, cold, fever, headache, body pain, and there's loose motion, there's burning in the eyes, there's a throat pain, cough, you have to isolate that person. Number two, what you are going to do, number two, you are going to consult a doctor. You are not going to consult your friends or your relatives or your neighbors what to do. You have to consult a doctor. It's very important because the doctor will tell you what to do next. Most likely he or she will tell you to do the corona COVID test, RT-PCR test, or a rapid test. There are many tests available, whichever is available to you. at the earliest you can do that. And sometimes people keep on waiting for the report. In some areas the report is taking 4 or 5 days, so you don't want to lose 4 or 5 days to contact a doctor. You had isolated, next day you call the doctor, maybe the doctor thinks that you have COVID symptoms, he will start you on medications and let the report come. But until the report comes, you cannot leave your room. You have to be isolated in the room with your door shut. It is not that somebody is coming, your mom is coming to give you chai, then going out, then is giving khana and then going out. This is not to be done because it's a complete isolation. Anybody who enters can catch those viruses and transmit to the other family members. You have to be very careful. Number two, consult a doctor, I said, and discuss all the things with your doctor, and be there in the separate room till the report comes. Now, third point, the report comes. So one is how to identify the symptoms. I told you. Number two, isolate and consult a doctor. Number three, when the report comes, well, if the report is positive, the doctor will treat you, and you will also, consult a doctor. What if it is negative? Sometimes it can come negative. So please don't think that you do not have COVID. If you have another person in your house which is COVID, and you also have little bit of symptoms, and the report comes negative, don't think that you are negative. We had many patients like that who thought that their report is negative, and they did not follow up any doctor, they did not start any treatment, and after a few days, 10th 11th day, their oxygen went down. So please consult a doctor even if their corona report is negative, and if you have symptoms and there's a positive family member. So it is, and there are reasons why sometimes it can come. Sometimes it is taken too early in the disease, or sometimes the collection is maybe not done properly, or sometimes the viral load is very less, and sometimes there is some mutation in the viruses. Maybe sometimes it's not able to pick that up. So I told you four reasons why it could be negative report, but you still have COVID. So you still have to consult a doctor and be in touch with the doctor on a daily basis. If not daily, at least alternate day, because things can go down anytime. I have seen people who have consulted doctor one, and the 10th day they are calling. In between, they are having 10 days of fever. That is a very dangerous situation. You should always be in contact with the doctor regarding your corona. It is a telemedicine available at every place in India. Now the doctor will tell you to do the blood test, or if you have done the blood test on your own, that is the fourth point I'm making. So we know how to suspect, then we have isolated and consulted doctor, then what to do with the report, then fourth is blood test and HRCT. I just wanted to clarify a few things. It is very much possible to call a person at home, the lab person who will do a home collection, and there are few tests which we tell people to do, so that we can know how much is the infection, the inflammation in the body. After that is done, please do not try to interpret themselves. Contact your doctor, discuss with them, and they will usually say to repeat the test after few days according to how the intensity of the patient is. So make sure you repeat those tests also and follow up with the doctor, because sometimes the blood test can tell you a lot of information. Obviously, you will be monitoring your temperature, monitoring your oxygen level and your heart rate, and will be discussing to your doctor with ongoing basis. Now, one thing I wanted to point about HRCT. HRCT is not a test to be done, decided by the patient. I have seen some people who do the corona test, and the next day they go and do an HRCT, and obviously it will come clean, and they will say that it is absolutely fine, I'm absolutely fine. So please do not do HRCT on the next day when you are found positive. Please leave it to the doctor for it to decide, or it is sometimes decided when the patient is not improving or having much fever, and when patient is deteriorating, or in you let the doctor decide. So don't do it early on. Now comes the treatment. Of course, you've been drinking all the kadas and the vegetable soup and the everything you're doing, but for the treatment, please rely upon the doctor's advice and the allopathic advice, because sometimes it could be confusing for people, because they are getting so many social media messages and WhatsApp and Google and friends and relatives, so it can confuse you. But please make sure you consult a doctor for the treatment. Doctors will be prescribing you vitamins, vitamin C, zinc, and paracetamol to control your fever. Hydrate yourself and be in touch with the doctor. So with that, I would say, I think I have covered the topics. If any one of you have questions to ask, please feel free. Go ahead. I will welcome all questions and I'll try to answer as many as possible. So one thing is, please don't become a doctor yourself. Consult all the time and be in touch with your doctor. Monica Chaudhary, thanks for your question. What if my RT-PCR is negative and I'm having the symptoms? So I just covered that topic. If you are having symptoms and the RT-PCR has come negative, it's possible that you have tested early on in your disease, or maybe the viral load is very less, but usually the RT-PCR will amplify it and pick up small amount of bacteria, viruses also. And sometimes very little chance that the technique is like it was not taken properly. And if you have symptoms, you should consult a doctor, and you should be treated like a COVID, and you should be in isolation for 14 days, and you should have a regular checkups like a regular COVID patients. I hope that answers your question, Monica. Now, Ms. Priya is asking a question that I am waiting for my report and have mild symptoms like fever and cold. Is there any medication that I can take until I get my results? Like I said, today only you should call a doctor in teleconsultation wherever you live. And then I can tell you, you can start your vitamin C, and you can start zinc tablets and paracetamol for your fever, cold, and you can take any cough syrup. But I would not advise the medications based on our this session. You should definitely ask your doctor. He or she will put you on additional medications, which would be prescribed after going through your complete history and complete knowledge of how much fever you have, 99, 100. All these small details are taken by the doctor, and then they will decide. But you should not wait for your report. You should actually consult the doctor today. So Mr. Riaz Ahmed is asking, after my first symptoms, on which day I can come out from room? So basically we calculate what was your first day of symptom, because we know that first week of symptoms are mild, though it would be fever, but by second week, sometimes oxygen falls down, or you can have more lethargy, more body pain. It's not a set pattern. Some people can have very high fever in the beginning, or some people can continue to have fever. So basically, to answer your question, we say 14 days total you have to stay in the room, though some viral shedding can happen of next week also. So that's why we say even after 14 days, use a separate bathroom, use a separate room to sleep, and then take your food and eat in a separate room, or at least away from other people. And when you want to mix around after 14 days, that is when you did not have fever for 3 days in a row and your 14 days are over. Then you can actually come out with your family with a mask on, but do these three things: sleep separate still, sanitize everything, and use the bathroom separately. And then with your government restriction, with the government report, what is advised is from the day of the test you will be quarantined for 14 days. So you cannot come out of the house for 14 days after the test report is positive. So you can calculate how many days. I have one question from Sir Banshu Jena. How wave 2 is different from wave 1? I'm sure you have noticed wave 1, we were successful in controlling it by early lockdowns. And plus, that was not that infective. Now, the viruses have mutated. Mostly all the viruses mutate. We have influenza viruses in our, there are so many cold cough viruses, they also mutate. So this time, first of all, it is mutated. So it is more infectious. Number two, second wave is different because it is affecting more younger people in their 20s, 30s, and 40s. And we have more data that it is not spread too much by the fruits and vegetables and the newspaper and parcels. It is more airborne. So if somebody has coughed somewhere in a very small enclosed space like a lift or something, if there's no ventilation, there are viruses floating around. So you should be always wearing a double mask. So double masking is the latest recommendation from CDC. So you can wear a surgical mask. You don't have to wear N95 all the time. N95 is for the medical professionals or for people who are really taking care of the COVID patients at home, nurses, and that is needed. For general public, you can do a surgical mask and then put a cloth mask. Please try to avoid masks which have the valves, the round valves, which are not a good mask, because it's one way valve. Whatever you are doing is it's exhaling, it is going outside in the atmosphere. So the simple mask is good, which fits you nicely and snugly. So we have another question. What are the symptoms of AP virus strain? Spreading or multiplication of viruses is faster. Yes, definitely. We had a UK strain, we had a South African strain, then we have a Indian double mutant strain, which was genomic sequencing was done in around about 10,000 samples, which was found it was a big part. It was playing in Maharashtra and in Punjab, and lately there has been a AP virus, an AP strain, which we call it, and it's quite infectious. And they become more infectious. That means they are going to spread faster. So if one person is affected in a family, and if they have not isolated themselves early on, it is going to affect the entire family. Or if one person they met came to their house for like 1 hour to drink some tea, coffee, then he will also get infected. Another question is Veena Maheshwari. She says that sanitizer smell is not bearable for me. Any other alternative? So basically, the best thing to clean your hands is the soap and water. And I'm sure you are not, leaving your house, because we can only leave our house for any emergencies. Otherwise, work from home, study from home, all the entertainment from home, FaceTime with the relatives and friends from home. And I think it's a time that your help in the house or helpers also, they can also be given leave, so they can also take care of their own health. So you have no external contact with the external environment. So only when you step outside, you have to use the sanitizer. But the sanitizer cannot be very, it has to be alcohol based, and you can choose maybe which is better smelling, or you can mix it with something if the smell bothers you. We have another question, Pooja Gurpreet Singh. She asked that my husband is RT-PCR negative and he has high fever for 3 days. Now he has no fever, but severe throat infection is there. Again, I would say anybody who has symptoms meaning the slightest of symptom, don't ignore it. Even if he had severe throat pain, I would say it is corona. Even if he has small fever, I would say corona. Why? Because we are doing so much precaution nowadays. Our kids are not going to school, nobody's going to college, nobody's going to movie hall, so we are not picking up the usual viruses which we used to have pre-corona. So I think it's fair to say that don't worry about the regular viruses, they have not there. Anything which is causing you fever, cough, high fever, throat pain, it is corona. So you should test it. You have done the right thing. But if it is still negative and he is having a high fever, you have to consult a doctor today, get the treatment started, get the blood test done. Don't worry about testing it again and making it positive. If you have the facility, yes, you can do it again, but don't wait that I will test it again, and if it calls positive, then I will treat it. That would be the wrong way. I'm treating many patients who have tested double, 2 times negative, and then I started the treatment for the first time only without waiting. And then if the patient is not doing well, we can do an HRCT also. Sometimes that helps to click the diagnosis. But as per experience, if you have symptoms, it is corona. So please start taking treatment from a doctor who is treating COVID. And Anupama is asking, vaccinated on 30th, and from second I've developed little irritation in the throat, should I undergo COVID test? So basically what we say is, when you have the vaccination done, after that 24 hour to 36 hours, you can have little bit of fever, body pain, or little bit of soreness in the place where you got the vaccination. And but usually it all ends in 36 hours or maximum 2 days. But you have started developing little bit throat irritation. If I would say, if it continues for another 2 days, you should isolate yourself right now. But if it continues for another 2 days, or you start developing any loss of sense of smell, fever, or any other symptom, because it is beyond 2 days now, get yourself tested. But today, what you are going to do, you are going to isolate yourself and then get it tested in couple of days. Another question is from Labda Sarangi. When a COVID patient is completely free from isolation, like I said before, you have to complete your 14 days. If you are at home and you are a mild case, there's a different guidelines for a very sick patient who has been admitted in the hospital for two weeks or 1 week. Then we don't say that 14 days and you can come home. If the patient is discharged, we give them additional 7 to 10 days to be isolated. When a mild person is having treatment at home and has completed 14 days and he does not have any fever for the last 3 days, then we say that, okay, you are not infectious to other people, but still, uh, uh, till another a few days, 4 or 5 days, you can use a separate bathroom, eat in a separate place, sleep separate, and when you want to mix around your family, wear a mask. Neetu Joshi is asking, I was in home isolation and tested negative on 26th April. My sense of smell isn't back properly. What to do? Well, sense of smell is a very common and a non-serious issue. I think you should be eating, all the things which you don't have to eat bland food, and it is very variable. Sometimes people get it back in 2 3 days. Some takes little more time, but it will come. Don't worry. And I think we have another question from Veena Maheshwari. It says that now it is said that it is airborne. We have many cases in our society. Is it safe to stand in the balcony or any precaution needed? I would say if your balcony is like totally open and is an open air space, so that is not a problem. Unless a person next to your balcony is coughing and is facing towards you. Other than that, it's an open area. Open area, it's always the air is flowing. So that should not be a problem. You can absolutely relax in your balcony. And if you want to meet somebody, you can wear a mask, full snug tight, two masks, and talk at a distance of 6 feet in an open area. That's not a problem. Don't invite anybody inside the house and don't go to anybody's house, no matter how close they are. And Miss Aba Ahuja is asking, it's been 5 days and temperature is around 100 degree. Report is expected tomorrow. Taking paracetamol. Fever is up and down. Please check your oxygen level also. Please consult a doctor by today evening, or if not possible, tomorrow, 5th day, you should be, really closely following with a doctor. And we at Fortis Hospital are doing non-stop consultation from morning to evening, on Microsoft Teams. We can see the patient and do consultation and the patient follow-ups after 2 3 days, or a more closer follow-up if we need it is to be done. So I'm sure you can reach a doctor in time today and do some blood tests and start the treatment right away. Another question comes from Shubha Setu. Hi doctor, can the virus spread through aerosols? And it can spread through open windows from neighbors who are infected. Like I said, yes, aerosol, but it is in a closed space. So if you go to the lift which your neighbor had used recently, yes, it's possible. If you don't wear a mask and you are not following hand hygiene, but in the balcony, it should not be a problem. Like I said, totally depends how close your balconies are. And but if you are far away and you are sitting in your balcony early in the morning, I don't think it's a problem. But yes, it is airborne. What precautions a heart patient should take after recovering from COVID? Is there any risk of clotting? See, every patient is different, and every patient's health concerns and problems are different, and age is different. If you have a family member who has a heart patient, you should, if they have any kind of symptoms like a chest pain, or suddenly they start feeling shortness of breath, or their oxygen level is falling down even after recovering, it could be 2 weeks, it could be 3 weeks, 4 weeks, or even 6 weeks, you should consult a doctor immediately, and if possible take them to the emergency room for some basic testing, and the doctor is going to examine the ER. Emergency rooms of all the hospitals are open. It's not that they will not see you. So you can consult a doctor first, And if it's an emergency, don't even, you can go to the emergency room right away. But patients who have heart disease or elderly, or they have severe disease, are usually discharged on some blood thinners. So Mr. Yogesh Kumar asked that I'm feeling well, however, cough and little pain in the chest. What would be the reason? Should I consult, or should I do COVID test? Yes, Mr. Yogesh, if you are having a cough and you are having little pain in the chest, it is a very good idea to do a COVID test. First, what you have to do is to isolate yourself in the room, shut the door, and your dinner would be kept outside your room. Nobody has to come inside your room. Get a consultation, get the test done, and don't leave the room until the doctor says so. Ms. Chandralekha Vinay asks us, hi Chandralekha, hi doctor, what all precautions we should take when maid comes home? If it is at all possible, Chandralekha, maybe for 1 or 2 weeks, you can give a leave to your maid. But if not possible, what I would suggest is let the maid take off her own mask at the outside of your house. You already keep surgical mask every day, a fresh mask. You keep it outside only. She wears that mask and then washes her hands from hair to hair, and just make sure and you teach them a habit of not touching their mask or not touching their face. And when the maid is inside the house, all the family members are going to wear a mask, and they should not go to the rooms which have elderly people, and you should ventilate the house. And that's all I could say. But if you can do without maid, it would be also a good idea. But if you do these things, I think you have taken adequate precautions. And there's another question from Madhab Chandra Layak. I have a very mild cough. When I contacted the doctor in the local government, he advised me to go under RT-PCR. Should I go for it? Absolutely. You should go to do a test, or rather, sometimes people come to your house. I just want to make it a point, don't go to any place which is very, very crowded and you have to wait in the line for 2 hours. That could be a potential, source of people, breathing on your shoulder. And so don't stand. If you have to wait, stand in the open. When your turn comes, go. But better if there is a facility that somebody can come home and do your swab test. And I think it is definitely a good idea to do that, and isolate yourself until the test report comes. And we have Ankur Jain. Ma'am, I have lost smell but no signs of fever, and I have myself, but I think the question got cut. If you want to ask me that you have nothing else but you have just lost sense of smell, I would say it is almost like a 99.9% sure that you have COVID. So please, if you're listening, I'm hoping you have already isolated yourself. But if not, please go to a room and isolate yourself and shut the room, and then get yourself tested, and consult a doctor. Even if the report doesn't come, consult a doctor. By the time the report will come, even if it comes negative, I think the loss of sense of smell is very, very peculiar for COVID. I would still think you have COVID, and do the appropriate treatment with your doctor, and do an isolation for full 14 days. Mr. Srinivas Patnaik is asking, is it okay if we take second dose of Covishield after 8 weeks? Yes, it is absolutely fine to take, do a gap of Covishield either 6 to 8 weeks. One more point I wanted to make it, just as if you had corona now, let's say the beginning of April, you should not take a vaccine after 2 months. So you have to take the gap of 2 months. If you had a vaccine in March, and then you can still have a gap of 2 months. If you had corona now, it is okay, no problem at all. Rishti Agarwal, if there is a way to handle sudden, is there a way to handle a sudden oxygen drop, no infection in the lungs? I doubt if there'll be a sudden drop in the oxygen level until and unless the patient already has some baseline lung problems like ILD or sleep apnea or COPD. There are other reasons of sudden oxygen drop also. If the patient has some other medical disease, But if the lungs are totally fine in the HRCT, I would doubt. It could be that you have to check the battery of your pulse oximeter. You have to make sure you are, putting it correctly. You have to make sure that, you are, you are not, your fingers are not cold and you don't have nail polish on your fingers. All these things you have to check before making a conclusion that your oxygen is down. If it is still down, please lay down on your tummy and you should consult a doctor and take the advice, and doctor will help you after taking a complete history, and then he will advise you the treatment. But please do not wait, consult a doctor. I have another question from Riaz Ahmed. ICMR says 2 days before not to repeat the test once tested positive because too much load on the lab. So I need not test again and make sure that I'm negative. Is that fine? And now I'm out of symptoms, no fever since 6 days. But absolutely, we have been saying this for the long time now. There is absolutely no need to test yourself again. That have I become negative? We know that 14 days isolation, complete isolation, and when you don't have fever for more than 3-4 days, consecutive 3-4 days, that means the viruses are gone and you will not be infectious to other people. So yes, there is no need to test it again. To answer your question, nobody should, unless you are traveling or your office is telling you to do the test. There is no need to do a test again. And Miss Bhattacharya is asking, my mother lives in Shanti Niketan. Her age is 75 at present. She is not a COVID patient, but her oxygen saturation is 94. Earlier, she had suffered from pneumonia. Oxygen saturation 94 is normal. Well, totally depends. Sometimes 95, 94 is a borderline case, and 1% here and there we give it to the pulse oximeter. But if she has always been 94 and she is absolutely fine, then it is 94 only, so it's okay. Sometimes people who have lung disease, baseline we call it COPD or some problems in the lung already, then sometimes they do okay with 92, but it has to be their baseline, and check with the doctor if it is okay. But only in small section of people who have lung diseases, their baseline could also be slightly lower than the normal people. Mr. Ajay is asking a long question. How many days we should repeat the D-dimer? So basically your doctor will tell you, but usually every 3-4 days, if we feel that the patient is symptomatic and we need to do the test, we repeat it. Are systemic inflammation subside by its own or should give steroids? Again, this is the question, and this is the things which the doctor who is in touch will decide. You will not decide as a patient. You will not take some kind of message from social media or your friends and family, because this is a big decision and your doctor will advise you. And today my father's 8th day of fever. I'm sorry, the question disappeared. From 2 days, 6-minute walk test normal. Aspirin, atorvastatin. I know you have repeated. It's like a full history. You are worried about thrombo. See, you have listed so many data. If you go with this data to a doctor, and I'm sure you must be having problem, getting in touch with the doctor. But please keep trying, and you can ask your friends who they have treated with. If you are in Bangalore or anywhere else, definitely you can book an appointment through Fortis, and we take lots and lots of calls every day for COVID patients, and all these queries would be settled if you consult a doctor. And again, we go to the next question. Mr. Raghavendra asked, what is the maximum number of days gap between the first and the second dose of vaccine? Well, good you asked me this question, because if it is a co-vaccine you have taken, the gap should be 1 month. And if you have taken Covishield, it's okay if you have a gap of 6 weeks, and 8 weeks also is fine. And we have these two vaccines available right now. So we have Shubha. Can the N95 mask be washed? No. The answer is N95 mask cannot be washed, should not be washed. What you can do is you can keep it in a dry place for 4-5 days, and you can reuse it one more time, and maybe you can use it one more time if you have used it very sparingly. If the mask is already soggy and cold, I mean, you should throw it away. I had some cases actually. One doctor or somebody some medical person use that mask every day for 10 days. I mean, he ended up with having COVID because it is all full of the viruses sticking on the outside surface, and somehow you touched your mask. So it should be not reused, but it can be medically. Sometimes we do get it cleaned, but it's a totally different way we do it. It should not be washed. Another question is Mr. Rahul Kalra asks if one is having sore throat and it's better with antibiotics, no cough, no fever, then also one should go for RT-PCR or home isolation. Excuse me. Usually in adults, I don't know who is the person in question. If it is a child, yes, they can have strep throat, but with so much of isolation, we are not seeing those kind of infections anymore. But if in adult people, it's not very common to have bacterial infections. 70 to 80% are viral infections in this thing. If it is gotten better, you will be still be in doubt whether have to have isolation or not. So better to do a test. And if you are completely fine, the test is negative, maybe you can come out of isolation. And if you don't have any fever at all. Veena Maheshwari is asking, we have now 3 to 4 options of vaccines available. Which one would you recommend for the mutating vaccine? Also getting the slot is a big issue. I completely agree. Getting a slot is a big issue because our population is 130 crores, which is equivalent to the whole US and Europe combined. So people are still waiting in Holland and Switzerland, and you just look at those Twitter, everybody's waiting. So it's not that we are only waiting. Yes, you have to have patience. Until then, you have to have a mask. And any vaccine you get is absolutely fantastic. Our job is to take the vaccine and let all the issues to be dealt with the scientists, immunologists, DCGI, and ICMR. Your job is to take the vaccine and protect yourself. Preeti Jha is asking, going for vaccination, being asymptomatic, how suggestive it is that I won't know whether I'm positive. Will it further aggravate the problem? See, basically, if you are having any kind of symptom or fever or sore throat, better not to go for the vaccine. Just wait it out for 10 to 14 days when it goes away. If you have absolutely no symptom, there is no recommendation that you have to test yourself that you are COVID negative and then you have to go for the vaccine. It is nothing like that. But if you are highly suspicious, you have a COVID patient in your home, you are also having a symptom little bit, and then I think it will be good idea to wait for 14 days. And if you tested positive, then you have to wait for 2 months. Then you have to get the vaccine. Don Arthur Alexander is asking, please suggest me that how much effective the first shot of Covishield, I mean the first what percentage? See, the first vaccine, the first shot, first dose is going to give you some amount of immunity, but after the second dose and after waiting for 2 to 4 weeks after the second dose, you will almost get 80% of immunity to fight the disease. That doesn't mean that you have to remove your mask. You still have to. All the doctors have gotten the 2 doses, and it's been 2 months since we got. We still wear masks. We still wear our headgear. We still wear the gown, and we still don't go outside. Going to the malls and or anywhere else. Total precaution, and sanitize hands if you're home. Soap and water, outside sanitizer. And we have another question, Umar Jahangir. Post-COVID recovery, after how many days should we take a vaccine? 2 months. You have to wait for 2 months before taking the vaccine. Riaz Ahmed, we are having a third question from Riaz Ahmed, very active participant today. After testing positive and recovered, do we need 3 months of gap to take the first dose? No, 2 months is okay. Some bodies are saying 3 months, but 2 months is good enough. You can take the vaccine after 2 months. Mansi Gupta, okay, we have a non-stop session. We have a flood of questions. So Mansi Gupta is asking if COVID vaccine is out of week beyond 8 weeks for second dose, what should be done? I think what you mean to ask is if you've already crossed 8 weeks, when can you take? You can take if it is available. If it is available after on the 9th week, 10th week, 11th week, 12th week, also you can take. It's okay. You can take it until 3 months. And I would say even that you have to wait, you can still take it. Raghavendra is asking one more question. How about vaccination for kids? We may get vaccine and save ourselves. What about our kids? Well, I have to say that Still, there is no recommendation guidelines by our local bodies and ICMR and DCGI. It has yet not been approved for the kids. So for kids, we have to still teach them how to wear a mask properly, not to touch their mask outside. Right now is a very critical stage for, so next 1 month, keep the kids inside the house. Earlier, I used to say that they can go out and play in open space, but I think it will be a good idea. You can just take your kid in a bicycle ride early in the morning and come back home without getting exposed to people, and play with them in the balcony. Open your doors and windows, ventilate, but make sure that you are teaching your kid, health, the hygiene, hand hygiene, not with the sanitizer, soap and water. Too much sanitizer in the kids is absolutely dangerous. We have Vijay Lakshmi Pandey. If someone has loose motion fever, you should go for COVID test. Absolutely. Fever, it is COVID. Loose motion is also a symptom of COVID. Isolate yourself today, first of all. Then consult a doctor. But second day, you can absolutely go for a test. Rather, you can call somebody at your home. You step outside the main door, he takes the swab, goes away. And then you will get the report. Kiran, Dheeraj, can pregnant women take the vaccine? As of now, pregnant women and lactating women, the scientists are working on giving the recommendation. But as of now, it is not approved. I'm sure it might be safe, but as of now, they don't have a final decision yet. I am 6 months pregnant, got influenza vaccine. Yes, it's a good idea you got the influenza vaccine, but definitely we are seeing less influenza right now because everybody's wearing a mask. And again, the influenza season again comes second time in the October, November, December time. So by that time, I'm sure that all the things about the pregnant lady vaccine will be sorted out. But as of now, you have to please be in the house and not be in touch with anybody who is going in and out, and tell them to really follow COVID appropriate behavior and protocols. So I think it's already 5:43. We've been answering questions for continuous 30 minutes. If we have more questions, we will be happy to answer. And plus, please watch this space at 5 p.m. every day. And other doctors, more and more doctors are coming to be with you, support you, guide you on this Facebook live session through Fortis Hospital or Fortis Healthcare. So thank you again, all of you, for joining this session. And I hope I was able to help you in answering your questions. So please be safe, put the mask, and if you can share this information with few of your family and friends, that would be great. So you will also be, a COVID ambassador. You are now equipped with the better information, and not from the social media. So thank you all again for listening. Be safe, mask up, sanitize, social distancing, and you have to put your mask again. And this is the Corona Namaste. Thank you so much.